Hi everyone, my name is Dr. Adidotun Abiodun, working with Amazing Physiotherapy Clinic. Amazing Physiotherapy Clinic is a vision-enabled clinic that is set up to relieve pain, that is set up to improve the general well-being of the populace. So today I'll be presenting on foot and ankle injuries. My co-presenter, my able colleague, is Dr. Pelumi Haoni. He will be presenting today with me. Today we'll be discussing on foot and ankle injuries. So we're talking about many problems associated with foot and ankle injuries. What started this presentation was recently we've been having to manage a caseload of conditions that are related to foot and ankle injuries, whereby patients come in, our clients come in, they complain of having foot and ankle problems. So we thought about how we can help, how we can assist the public in, first of all, in educating them about the foot, about the ankles, and how to prevent injuries, how to prevent them from having one problem or one issue or the other. So we try to set up this presentation to educate people, to educate the public, and also for them to be able to manage their problems properly. So that is the reason for this presentation. So I go on. So this is my outline. I have an introduction. I'll be talking about the brief anatomy. What can cause foot and ankle problems. We're talking also about risk factors, and most importantly, the prevention and treatment of foot and ankle problem. Just like I said, recently we've been having to deal with a lot of issues surrounding the ankle and the knee, because when you look at the foot, it's as small as it is, or as small as they are actually complex structures which have so many structures surrounding it. So we need to educate the public, we need to educate people, we need to inform people about their bodies, and which we believe which is our core values at Amazing Physiotherapy, to be able to help people, give people the benefits of their body, such that they don't have to depend so much on painkillers. They don't have to disturbing their doctors. Let me use the word disturbing, pardon me. So we want to limit or totally eradicate these problems from this patient. That was why we set up a live presentation like this. So I'll be talking on introduction. I'll be introducing it, the anatomy, what causes, what can lead to foot and ankle problems, the risk factors, and also the prevention and the treatment. So your feet and the ankle joints are made for walking, running, jumping, balancing, and climbing. Just like I said earlier, it is a very complex body part, because why I said that, because it houses roughly 28 bones, which is roughly a quarter of the total bones in the entire body. I think that should be 208 or so. So it also has about 30 joints and more than 100 muscles, ligaments, and tendons. This is why I called it complex, because if you look at it, the structure looks small, but then it has a lot of bones, a lot of muscles, a lot of structures like muscles and ligaments around the parts of that body. So, and all these structures, they work together like a fine-tuned machinery to produce two important functions. What are the two most important functions of the feet? They are just for propulsion and for weight bearing. These functions actually require a high degree of stability, because for the foot to be able to propel well, for the foot to be able to bear enough the weight of the body, there has to be a high degree of stability for them to be able to perform that function. And your feet are designed by nature to be very flexible, so it can adapt to uneven surfaces, which is why each foot has so many bones and joints. You know, we can't, let's say you're walking on different terrains, you're walking on, sometimes you have to climb, sometimes you have to walk on flat surfaces, sometimes you have to walk on rough surfaces. So your foot are designed to be able to cope with these different terrains and surfaces you actually need to walk upon. So what is the brief anatomy of the foot and ankle? The feet are flexible structures of bones, joints, muscles, and soft tissues that let us stand and perform our activities of daily living, like walking, running, and jumping. They are divided into 3 sections, namely the front part, the middle part, and the back part. So in these sections of the foot, there are bones, joints, muscles, tendons, and ligaments. The front part of the foot include the toes, or phalanges, as we call it in the medical term. There are actually 14 toe bones, 14 of them in each foot. We also have the middle foot, and this middle foot consists majorly of 5 irregularly shaped bones called the tarsals. And we also have the back foot. The back foot has just 2 large bones, which we call in medical term talus and the calcaneus. If you look at the back of the foot, you would see that they are actually these 2 large bones. We will talk about it later when we are demonstrating. So we have the larger of the 2 is calcaneus, which forms the heel of the foot, and the talus rests on the top of the calcaneus and forms the pivoting joint of the ankle. So this is the image. These are the bones that just to display the skeletal structure of the foot. As we can see here, these are the phalanges. These are the phalanges, or what we call the toes. These are the metatarsal, and this is the calcaneus I just talked about, and the hind foot. And closely lying on top of it is the talus. I explained that it attaches to the bone of the foreleg, that is the tibia. Although I need to say this, it's supposed to be muscles that join the bones together. So, but this picture is only showing the skeletal structure of the foot. So what are these joints? What are the structures in the foot? We have the joints, we have the muscles, we have the tendons and ligaments. Just like, a joint is formed at the junction between 2 or more bones. So each big foot has 2 joints, and the other 4 toes have 3 joints each. We also have the muscles. The picture I showed earlier did not demonstrate the muscles. The muscles control movements, and the muscles that control the movements of the foot actually originate in the lower leg and are attached to the bones of the foot with tendons. So what I'm saying is that tendons actually connect the muscles to bones, such as by the time you need to move a part, by the time you need to move maybe you want to move a part of your body, it is actually the tendon that pulls on that bone that enables it to move. Also, we have the tendons and ligaments, and the most important tendon in the foot is the Achilles tendon, which runs from the calf muscles to the hip. It is the strongest and the largest tendinous structure in the body. It makes it impossible for you to run, to jump, to climb stairs, and stand on your toes. So that means if there is a problem with this particular tendon or calf muscles, that means we will have issues or difficulty in running, in jumping, in climbing stairs, or any of these activities. There are also other important tendons like tibialis anterior and tibialis posterior, all of which make specific movements to be possible. And these are the primary ligaments of the foot. They are namely the plantar fascia, the plantar calcaneal ligament, and calcaneocuboid ligaments. Their functions are to provide strength for walking and assisting in balance. Just like I said, these structures, they work hand in hand. It's just like a machinery. They function all at once to give a particular function. That means when there is a problem with one thing, the others might not be able to function optimally. So like I said, this ligament I just listed, they provide strength for walking and they assist with balance. So who is this workshop for? The workshop is for you if you are experiencing foot and or ankle pain, or if you want to prevent foot and ankle pain. Because when we talk about medicine, generally we also talk about preventative medicine. That means we want to prevent things from happening. English used to tell us that prevention is better than cure. So it's always better to prevent. It's even cheaper than cure. So if you want to prevent foot and ankle pain, this is also for you. Or if you know someone that is suffering from foot and ankle pain, maybe your relatives or your neighbor, and probably they are not privileged to have access to this information, you can key into it and help them. They will be glad and they will be appreciative of such a gesture. Or if this seminar is also good for you, if you have been experiencing and suffering from foot and ankle pain and have been taking pills and injections, but you seem not to be getting better. So what is in this for you? Why should you follow through? Why should you stay through the course of this workshop? To stay pain-free and reduce any foot or ankle issues, to be more productive and effective, to be able to participate freely in outdoor sports exercise. Let me say this. Sometimes when people have foot issues, you find out that their level of activity reduces. And once that reduces, it leads to other problems. It leads to a sedentary lifestyle, which leads to them gaining more weight. than they are usually accustomed to. So it's definitely obesity. Once obesity comes in, it can lead to other cardiorespiratory problems. It can lead to heart problems, or it can lead to a problem with the blood vessels. So we talked about it in a very, that means we have to talk about it in a very holistic way, because the problem with the ankle or the foot will generally reduce the activity level or our participation of such person in sporting activities or other outdoor activities. So we need to prevent it, and we also need to treat it if accordingly, if we will have it. So this seminar, this workshop will generally help our health, help our well-being. In our well-being will be more productive and effective. And then that some people complain of having foot issues, which has been debilitating enough. So these people can't go to work, they can't perform the activities of daily living, they can't do one or two things because of this pain. So this workshop is made for that set of public. So what are the common problems associated with foot and the ankle? They have arthritis, they have bursitis, they have fracture, they have plantar fasciitis, sprains and strain, tendonitis, and badly fitting footwears. We will talk on this as we proceed. So what are the symptoms usually associated with foot and ankle injuries? We have foot pain, we have ache pain, sharp pain, ankle pain, instability, decreased movement, stiffness, and cracking of the joints, and then deformity. First, we are going to discuss is arthritis. So you can see this picture. Arthritis is caused when there is inflammation of one or more joints, and this can lead to pain and stiffness of the ankle and the foot. This painful inflammation and stiffness can be brought on by many degenerative joint conditions. In fact, there are over 100 types of arthritis, which includes rheumatoid, psoriatic, post-traumatic, and osteoarthritis. Swelling, tenderness, and sharp pain are common symptoms of arthritis of any of the joints of the foot. So you just find out that that place starts, once there is arthritis, that place will start swelling up. You will start having something like a redness or discoloration. And a classical feature of arthritis is there will be tenderness at that joint, so that once you touch it or apply any form of pressure, there is always a growing. So another problem that can be associated with foot and the ankle is bursitis, foot in this case. This is caused by inflammation of the fluid-filled sacs that reduce friction in the joint. As you can see from this image, these are the bursa, metatarsophalangeal bursa. So when it becomes inflamed, it leads to a condition called bursitis. And this is usually brought on by injury or infection on the bursa. Pain, swelling, tenderness, and reduced range of motion are the common symptoms associated with bursitis. We also have another one, plantar fasciitis. This is the inflammation of the thick tissue on the underside of the foot, called the plantar fascia. My colleague will be demonstrating that as this proceed. What is plantar fascia? It is a connective tissue that connects the heel bone to the toes and creates the arc of the foot. The exact cause of this condition, plantar fasciitis, is unknown, but it can develop from repeated tears in the foot tissue. Aging and other stress in the area can also lead to plantar fasciitis. Another condition here worthy of note is tendonitis. Tendonitis is inflammation of the thick rope-like tissues that connect the muscles to bone. You know, if you have been following this presentation, when I started, I talked about how tendons connect muscles to bone. So once there is an inflammation on this structure that connects the muscles to bone, that's what we have tendonitis. And it is mostly caused by overuse. For example, someone who runs a lot, you know, when you run a lot, that means you're actually using the structure more than is probably accustomed to. So that's what we call an overuse injury. Though it can be acute as well, that means it can trauma, probably something falling on the foot, can also lead to tendonitis. What are the symptoms associated with tendonitis? We have pain, which is the classical symptoms, and also there will be loss of range of motion. Loss of range of motion simply means you will not be able to move it as you are supposed to, as you are meant to. So this is it. It's a picture. As you can see, this is the Achilles tendon. The red area shows there's an inflammation, Achilles tendonitis for the Achilles tendon, the tendon that connects the heel to the calf muscles of the upper leg, and also extensor tendon, and see, and also peroneal tendonitis. And if you look at the image on the right hand side of the screen, you will see that you will see swelling around this ankle, as you can see. So this is just a picture depicting tendonitis. Moving on, sprains and strains are common problem. In fact, almost everybody has actually have to experience this at one point in their lives. Let me just tell you a brief story. I can remember a particular year when I was actually walking on the road with my mom. As we were walking, she just missed a step, so that actually caused her some ankle sprain. So I've been a physiotherapist, so I was able to manage her myself just for a few weeks before she started getting better. Signs, what are those signs that we experience? We have pain as usual and swelling around the joints. So sprains are actually stretched or torn ligaments of the ankle. You know, I said earlier that there are many ligaments in the ankle. So sprain occurs when those ligaments are actually stretched or torn. Sprains can be painful and rank in 3 degrees of severity, from a slight stretch, which is 4th degree, to a complete tear or rupture, which is a 3rd degree. We also have fracture. We all know what fracture means. Fracture is when there's a broken bone, when the bone is broken. So in ankle or foot fractures, it is quite obvious, because anybody that is having this will find it difficult to bear weight, because when we talk about fracture, inability to bear weight become as a feature of fracture any part of the body. We can also have pain or swelling. Other times, fracture can be quite subtle and easily missed. So sometimes surgery is usually required to ensure that the fracture heals well in time. We also have a very important one that we need to talk about today. It's called bunions. I know most of us, let me not say most of us, many of us would have experienced it because it's usually a common problem. It's a common problem in any given population. It's usually caused when people wear tight shoes. You know, when I was talking about the causes of this ankle and foot injuries, I talked about badly fitting shoes or footwear. So this is actually what can result into bunions. Let me explain. A bunion is a bony bump that forms at the base of the big toe. It's medically termed hallux valgus. It occurs when some of the bones in the front part of your foot move out of place. This causes the tip of your big toe to get pulled towards the smaller toe and forces the joint at the base of your big toe to stick out. Redness and soreness may appear over the affected area. I will show you a picture of this as we proceed, so that once you have it, you will know that, oh, this is what I am experiencing, and you'll be able to address it accordingly. So what are the risk factors? Risk factors are some factors that can generally lead to this problems with foot or ankle. Just like in any risk factors, we can have the ones that are modifiable, and we can have the ones that are non-modifiable. So a lot of those risk factors are age, obesity, the previous injuries, poor posture and maintenance of the foot. We also have poor athletic conditioning, gender, muscle and ligament fatigue, poor or badly fitting shoes, or poor training environments. Let me try and explain one or two of these risk factors. When we talk about poor posture and poor biomechanics, generally, like I said, the foot has many structures. That means for problem not to come, there's a need for us to always maintain good posture at all times, probably when we are standing or when we are walking, so as not to put structures on the stretch. Also, poor athletic conditioning is also a risk factor that can actually lead to or precipitate foot and ankle injuries, in the sense that when you are an athlete, probably when you are a tennis player, or you run a lot, or you play football, there's always need for warm up and preparation. So this preparation will include stretching the foot, moving the foot before that actual exercise, so as to prevent. We are talking about the risk factors. Also, we also need to talk about the poor and badly fitting shoes. Once you wear a poor and badly fitting shoes over a long period of time, it causes problems with the foot. Also, a poor training environment. I need to say this specifically because sometimes when you are, imagine a football player, imagine trying to play football on a tennis court. So that already tells you that you are actually working in an environment not suited for that sport, and that means you are increasing the risk of having injuries like foot and ankle injuries, as we are discussing. So this is a picture here. So we move on. How do I know if I have any of these problems? It is difficult to know if you have a foot and ankle problems. It is not difficult, pardon me. When you start to feel pain, discomfort, and stiffness in any part of the foot and ankle, just know that there is a problem somewhere that needs to be addressed. Your ankle may swell, and you will find out that you are not able to bear the weight of your body on it. You know, when we talk about the ankle is an important structure on the body that bears weight, the weight of the body. So once you find out that you are not able to bear weight accordingly, once you're not able to put the weight of your body on it, just know that there is a problem somewhere that needs to be addressed. And you should also know that those problems should be addressed immediately so as not to cause further problems. Usually, foot and ankle pain usually get better with rest, ice, or over-the-counter pain medications such like paracetamol and other non-steroidal anti-inflammatory drugs. So I'm continuing. It does not matter the symptoms you are having, you need to pay attention to it so it doesn't aggravate further. You know, people do this a lot. People do this a lot. They find out that once the problem starts, they would wait for months or they will wait for weeks before they actually seek the professional advice. It is very, very bad. It is not good because once the problem starts like that, and you wait or you don't do anything about it, you are actually aggravating the problems more, and you are actually increasing the cost of treatment for it. For example, let's say a problem that starts in a week, and you come to your clinic to get it checked up, will be different from a problem that started for a period of, let's say, 2 years. There will be a marked difference in the treatment and also in the cost of the treatment. So it's always better, always advisable for you to seek professional help or professional guide when any of these problems, any of these symptoms surface. First, you need to see a doctor or your healthcare providers. They will help you through their basic knowledge of anatomy and physiology of human body to accurately diagnose the problem. And how this is done is through careful and thorough examination and assessment of your foot and ankle. It may just be a part or the whole affected foot or feet. Remember that we talked about how there are many structures in the foot and the ankle. This assessment is carried out by observation if it is swelling and redness, palpation, and movement. So when you come for assessment, the physiotherapist would touch. The physiotherapist would ask you to carry out movement. We call in medical terms, we call some movement provocative movement test. We will ask you to perform some movement to know if there is a problem with that part of the body, in this case, the foot and the ankle. Also, there may also be need for diagnostic scans such as MRI, X-ray, or CT. This is carried out to ascertain or confirm the presence of any pathology on the foot and the ankle. So we are gradually approaching the second parts of the presentation. I describe this as how to keep your feet happy. How to keep your feet happy. What that implies is how to prevent injuries or how to treat injuries. Whether you're having an issue already, this will guide you on how to address it properly in case you don't have access to an health practitioner or a physiotherapist. So if you're having pain at the bottom of your foot, this is usually a sharp shooting pain, and it's called plantar fasciitis, like I described earlier. So let me just describe it. So around here, like I said, the plantar fascia spans from the heel to the toe. So if you are having a sharp shooting pain around this structure, so it's usually symptoms of plantar fasciitis. So what you need to do is to give yourself a massage by rolling a golf ball. I'm holding a golf ball, by rolling it around, around your foot as I'm doing. Or if you can't get a golf ball, you can just get a frozen water bottle. Or you can get a hot water bottle, depends on the one that you have. This will help to relieve the inflammation that you are having. Also, you can also wear, there's something we call a metatarsal pad, like a support into your shoe, so that the heel will not be directly on the flat surface of the shoe. You can wear something like a pad, like a metatarsal support. So that's that about the first one. If you're having a sharp shooting pain at the heel of your foot. Also, if you're having pain on the big toe, you can blame it on redness, soreness, and swelling. You can blame it on bunion. And what's a bunion? I described it earlier. It's a bony, just like a bony bump that forms at the base of your big toe. It can be hereditary. Wearing of tight and ill-fitting shoes can exacerbate the problem. So what are you supposed to do if you are having a problem like this? As you can see, look at this picture that I have here, this image, and see that's how bunion looks like, just at the base of the big toe. So what you can do about it is what we call a bunion stretch. I will demonstrate it now. Bunion stretch. So you move your big toe away from the other toes. Move it this way with one hand, and with the other hand you apply a deep tissue massage. You apply deep tissue massage the way I'm doing. So something like that, it should help you get better, and it should relieve the pain you are experiencing. So I'll move on. So when you're having pain at your when you're having pain at your ankle top, probably when you're walking or running, you feel a quick pinch just below where your shoelaces are tied. This could be a nerve called the peroneal nerve, a nerve that runs down from your leg to your foot. What you can do is leave the last two of the shoelace untied. And if the pain persists after doing that, then you can consult your physiotherapist or any of your healthcare providers. I hope this is quite explanatory enough. Sometimes when you tie your shoelace around that place, you'll feel something like a pinch on your skin. So you have to relax it a little bit for comfort. If the pain then passes, that means you need to see a physiotherapist. Also, if you have pain at the Achilles, so this is a shooting pain above the heel and below the calf muscles. It's commonly called tendonitis. And over time, your ankle feels less flexible. Overuse is usually the cause of these problems, and it is common in runners. Something that I explained earlier, that once people run a lot, this is an overuse injury. That means the tendon will start getting inflamed. Inflammation and swelling of the Achilles tendon are common symptoms. What do you need to do? Rest, ice application, and the use of anti-inflammatory medications are used to combat these problems. And adequate warm-ups and stretching programs need to be carried out before running to prevent the pain from starting in the first place. Let me describe it. Okay, so you definitely it will be performing if it was the athlete that is used to running. Probably before running, you just need to stretch, good, stretch the Achilles tendon, probably before running or doing all those activities. It's not just for runners, probably people that are playing football, people that are into football or other sporting activities can ensure they go through these adequate warm-up programs and stretching programs. This is to prevent Achilles tendonitis from happening in the first place. So we are at the end of our presentation. It's a wonderful presentation. I don't know if you have any questions or if you have any need for any professional to see you. You can come to visit us at our clinics. At one of our clinics, either you choose the Wuse Clinic or Gariki or Guaripa Clinic, depending on the proximity. Depending on the closeness to you, we'll be glad to assess you. We'll be glad to give you the right guidance that you need to stop this problem you are having that has been persistent over time. Thank you all for listening. God bless you. Stop video, right? So is there any question? Do you have any question?
I don't have any question. That was a wonderful presentation. Thank you very much.
Okay. Any other question? No question, any other contribution? You can.
Hello, good afternoon. Dr. Gordon has done a very good job, and we're happy to be here for you today. if you have any questions concerning your foot and ankle that we have not done justice to in this webinar, I would like you to walk into any of our branches, amazing physiotherapy branches. We have branches in Gaki, in Gwarimpa, in Wuse, in Jabi, Abuja. Generally, we have different branches in Abuja. So you can walk into any of our branches and get assessed by our specialist concerning your foot and ankle problem. We have had different cases of ankle problem, knee problem. Some are even, many of the patients walk into the clinic, some limping, some in very difficult pain. But by our expertise, we've been able to help them relieve their pain and take them back to function. So if you have any concern concerning your foot and ankle, we'll be happy to have you and to be of help. Thank you for coming to our webinar today. And we say we'll be ending this webinar here today. So do you have anything, other thing to share with our audience?
All right. I'm very glad for you to listen to us all throughout the course of this webinar. I know that we have learned one or two things as regards what we discussed the last 1 hour. Thank you. God bless you. Bye.
All right. Thank you. Bye.